What does it take to become a medical laboratory scientist? Age 18, you graduate high school. You decide you want to work in healthcare, but instead of treating patients directly, you want to be the person running the tests that help doctors figure out what's actually wrong. Salary, $0. Age 19, lab science school. Hematology, microbiology, immunology, clinical chemistry, molecular diagnostics, blood banking. Some classes are biology. Others are essentially detective work with a microscope. You learn to identify bacteria by their smell, parasites by their movement, cancer cells by the way they refuse to look normal. Salary, $0. Age 22, you graduate with a bachelor's in medical laboratory science. 4 years of textbooks, lab rotations, and a clinical internship where you spent months running real samples in a real hospital under the watch of someone who's done this for 20 years. Then comes the ASCP Board of Certification exam. Roughly 100 questions across every subject in the lab. 3 hours. You pass. You're officially an MLS. Salary, $0. Age 23, first job, hospital lab, night shift. The ER is busy at 3 a.m. A patient comes in unresponsive. The doctor orders 12 different tests, stat. You're the one running them. Hemoglobin, white blood cell count, troponin, lactate, blood cultures. Every result you push out helps decide whether that patient gets antibiotics, surgery, a transfusion, or none of the above. Salary, $65,000. Age 26, experienced MLS. You can spot a malaria parasite on a slide before the automated analyzer flags it. You know which bacteria smells like grape juice and which one smells like rotting fish. Salary, $80,000. Age 30, specialty certification. You pick a discipline, blood bank, microbiology, molecular, hematology, and you go deep. Months of extra training. Another ASCP exam. You pass. Now you're the person other techs page when something on the bench doesn't make sense. Salary, $90,000. Age 38, lead tech in a specialty unit. You run blood bank for a level 1 trauma center. A mass casualty event comes in. 6 patients. 3 of them are bleeding out. You're issuing units of O-negative blood faster than the cooler can be restocked, cross-matching emergency releases, and tracking every single product across 6 different patients in 3 different operating rooms. 1 mismatched bag and someone dies in surgery from a transfusion reaction. Salary, $100,000. Age 45, lab manager. You run a department of 30 technologists across 3 shifts. Most of your day is staffing, regulations, equipment validations, and the kind of quality control paperwork the public has no idea exists. The lab runs 24 hours a day, 365 days a year. It does not close. Salary, $135,000 plus.